Good afternoon, everyone. I'm Kate Hay, the Operations Manager for Home Haven, and welcome to our presentation, Stamp Out Stroke, Stroke Awareness and Prevention with the Yale Stroke Team. Thank you to our Health and Wellness Committee, and especially to Susan Bears, a member of that committee, for arranging this presentation. It is my pleasure to introduce Susan Bears.
Oh, hi, everyone. I'm Susan Bears, and I'm a member of Home Haven and a member of Home Haven's Health and Wellness Committee, which is chaired by Pat Jackson Allen, who couldn't be here today. She's traveling. And also Lori Lowell I think she's here, but she just got back from a meeting. So Kate and I are filling in for her, our executive director, Lori Lowell. So it's my pleasure to introduce this program, Stamp Out Stroke, presented by two clinicians from the Yale New Haven Stroke Team at Yale New Haven Hospital, Nicole Veltri and Dawn Petrucci. And they will introduce themselves in more detail and talk to us about stroke awareness and prevention. So thank you very much for being here with us to discuss this important topic.
Of course. Thank you for having us, Susan. Appreciate it. My name is Nicole. I'm one of the nurse practitioners, and I work with the stroke team at Yale.
And my name is Dawn, and I am a stroke nurse navigator, and I also work with the team here at Yale.
You were able to hear us going the back and forth, is that right? Okay, great. So I'm just going to go ahead and share my screen. All right. And everyone can see that, okay?
Yes.
All right, great. So yeah, like everyone said, this is our Stamp Out Stroke program. We go out into the community and bring awareness and education about stroke and signs and symptoms and things to help teach the community. Just a couple disclosures. So the information today that we're providing, it is general information about stroke. There are stroke risk factors, the symptoms, and the treatment. And just to be aware that we are not able to provide any individualized medical opinions or suggestions regarding your specific health. That those questions should be reserved for your healthcare provider, but we can generally answer questions about stroke specific, just generalized. So I'll go ahead and start with kind of what do you know about stroke? So there's some quick facts to kind of learn. So every 40 seconds, someone actually suffers a stroke, and 80% of strokes are preventable. The stroke itself is the cause of the number 5 cause of death, but the number 1 cause of disability in the United States. When you are able to recognize the signs and symptoms of stroke and know to call 911, you can help save a life, which is amazing. So we'll first just kind of start by talking about the brain generally. So the brain itself is the main control center of your body. It helps us communicate by speaking. It helps us move, see, feel, sleep. Pretty much everything is controlled by the brain. In order for the brain to work, nutrient-rich blood flow will go like from your heart up into the brain to help keep it working. And it communicates through the heart, from the heart through 4 major blood vessels going up from the heart into the brain. And those are the 2 carotid arteries, which are in the front, and the 2 vertebral arteries, which are located coming up through the back of the brain, as you can see in this picture here. There are 2. Stroke itself is injury or damage to the brain from interruption of blood supply. There's two specific types of stroke, two categories of stroke, I should say. So one is ischemic stroke, and that is caused by lack of blood flow to the brain, usually caused by a clot or something blocking the flow to the brain tissue. An ischemic stroke is the most common type of stroke. The other category of stroke is called a hemorrhagic or bleeding stroke. And that is caused by a rupture or damage to one of the blood vessels that opens up, causing bleeding to go into the brain tissue and cause a hemorrhagic type of stroke. Oh, I already spoiled that. Which do you think is the most common? And it is ischemic. All right, so Dawn is going to talk to us a little bit about risk factors for stroke.
Okay. So there are some non-modifiable risk factors, meaning these are ones that we cannot change. Those are our age, stroke. It becomes more common as we age. Gender, stroke is more common in women than men. And family history. We can't change our family history, but to be aware of it and, go forward taking precautions. The modifiable risk factors from stroke are things that we like to really focus on. Those are things that we can change. We can impact our health, and in doing so, hopefully prevent stroke in the future. So the number one modifiable risk factor of stroke is high blood pressure. So that's something your doctor checks every time you go for a checkup. And that's why it's really important to keep our blood pressure under control. Smoking is another modifiable risk factor. Physical inactivity, even just being able to, get out and walk around for 30 minutes a couple of times a week is really important. Obesity, so keeping our weight under control is important to prevent stroke. And that can also impact some of the other things on this list, such as high cholesterol, diabetes, atrial fibrillation, and sleep apnea. So, sometimes these are things that we have. If we have diabetes, we can't make it go away, but if we keep it under control through good follow-up with our providers, we can impact the effect that they have on our risk for stroke. And again, it's also important to keep up to date on cancer screenings and vaccinations. High blood pressure, you may have heard it called the silent killer in the past. It's called that because oftentimes people are not aware they have high blood pressure until it becomes a problem. Because there's generally not a feeling or symptom you get when you have high blood pressure. So high blood pressure not only is the number one modifiable risk factor for stroke, but it can also can cause us to have heart attacks, can lead to kidney failure and heart failure. If you've been diagnosed with hypertension or high blood pressure, it's important to have a conversation with your primary care doctor about monitoring blood pressure at home. They sell cuffs these days at the local drugstore, through mail order, through Amazon, relatively inexpensive, and you can monitor blood pressure at home in addition to when you go to the doctor. It's also important to talk to your doctor about any medications you may be taking, and to address any barriers you may face when managing your blood pressure. High blood pressure can be checked, lowered, and controlled, and managing your blood pressure, again, can help decrease your risk of stroke. Psychosocial factors and reducing stroke risk. So, I'm sure you've heard people say I was under a lot of stress or I was having a lot of anxiety. All these things, stress, depression, anxiety, post-traumatic stress disorder, feeling isolated or lonely, they can all impact on our health. What can we do to help with this, maintaining a healthy lifestyle. Again, physical activity, even for a small amount of time, is great. Getting outside, especially now as the weather is getting nicer, you know, getting some fresh air, and just doing some mindful activities. Other things that can help are healthy social behaviors, spending time with family and friends, taking up a hobby, engaging in something that's enjoyable to you, and asking for help when you need help. And you know, programs such as this that you're taking part in right now fit right into that category of you know, you're doing things that are supporting your healthy social behavior. And most importantly, if you're feeling any of these things, stress, depression, anxiety, it's really important to talk to somebody and share your feelings, concerns with someone you trust and a healthcare provider. And sometimes, you know, it's easier to talk to a stranger than it is to family. Often, you know, we don't want to burden our families with how we're feeling, but having an open conversation is really important to our health and well-being. So what can you do to lower your risk of stroke? We talked about a lot of this. Maintaining a heart healthy diet, you know, things that are low in saturated fat, you know, whole grains as opposed to simple grains, simple carbohydrates, avoiding a lot of sugar in our diets, eating lean meats, or plant-based diet. All of those can help support your heart, and in doing so, you're also supporting your brain. Again, increasing the physical activity. If you are a smoker, to quit smoking, and regular visits with the healthcare provider and talking to your doctor or your provider about your blood sugar, your blood pressure, cholesterol, family history of stroke. It's really important that we all be partners in our own healthcare. How do you know if somebody might be having a
Okay, so we'll go over kind of some of the signs and symptoms of stroke specifically for you to be aware of. In this picture here, you can see that this person has some drooping of the face, which is, oh, is that gonna let us play it? Okay. Before we couldn't get the video to play, but I will try to do that and see if we can. So hang on one second. Okay, great. Okay, so, oh, I'm sorry, I didn't know it was so dark. Okay, so in that video, it kind of just shows a scene of a stroke actually happening. Hang on, let me try this. Okay, there we go. Of a stroke actually happening real time. If you noticed, some of the symptoms that you could see in the video specifically are that he had some drooping of his face. Also, he looked like he was having difficulty lifting that arm up as well, and he wasn't able to speak. They noticed those symptoms right away and were able to call 911, which is exactly what we wanted to teach you here today. So to go a little more specifically over signs and symptoms of stroke, we use an acronym called BFAST. And that helps you differentiate the different types of symptoms that you may see. Generally speaking, these symptoms come on extremely quickly. People are usually fine doing what they're doing, speaking, talking, and then all of a sudden they're not. Suddenly these symptoms happen. So the B specifically stands for balance. So any sudden loss of balance, whether you're can't really sit up, you're walking and all of a sudden just kind of veering towards one side. The E stands for eyes. Most specifically, this is described as loss of vision. So if you're looking, maybe for example, watching the TV and half of the screen is missing or black, or a quarter of the screen is missing. In addition, it could be sudden onset double vision. F stands for face, as we saw in the video. So drooping of the face, usually the bottom side, possibly drooling out of that side, or the eye as well. A stands for arm. It also includes the leg, but the symptoms you're looking for that are any weakness, as seen in the video, in the arm or leg, or sensory deficits. So numbness or tingling that could be on one side of the body. S is for speech. So that is abnormal speech, whether that be inability completely to speak, kind of thinking you want to speak but unable to say what you want to say. For people who are witnessing an event, if the person is trying to speak to you and it's slurred or garbled or just not making sense, they're not saying the right words, those are symptoms. And then the T stands for time, and time is brain, is what we say here. So the faster you get to the hospital, the best chance we have to evaluate, see what's going on, and possibly treat if we think you are having a stroke. In addition, if you have a new sudden onset headache or something described as the worst headache of your life, the worst headache you've ever had, that typically is more so towards the hemorrhagic stroke. But that is also a symptom of possible stroke to look out for. So if you see someone having a stroke, the first thing, or you yourself, if you're able to, can call 911. The faster, like I said, the faster you get to the hospital, the faster you can be evaluated and treated, and hopefully suffer less consequences, and possibly be able to make a stroke that could have been much bigger, possibly smaller. And cause less debilitating symptoms moving forward. So specifically, this kind of pea size, which is fairly large brain, every 12 minutes is damaged when a stroke is happening. 2 million brain cells die every minute, increasing the risk of permanent damage, disability, or death. So again, if you see any of these warning signs, immediately call 911. So what are these possible treatments that we can do? So if we suspect that someone's having an ischemic stroke, we can administer a medication called tissue plasminogen activator, or TPA. This is a very potent clot busting medication that the idea is that it can dissolve the clot that's blocking the flow going to the brain. However, this medication is only safe to be given within 3 to 4.5 hours when your symptoms start. So that's why it's very important to be aware of the symptoms and go to the hospital as soon as possible, so that you're within that window for us to possibly administer that medication. Another intervention that can be done is something called mechanical thrombectomy, which is actually, if we see a blood clot in one of those major arteries in the brain, we can perform neurointerventionalists or neurosurgeons are able to perform a procedure where they put a catheter in, usually through the groin, sometimes through the wrist, go up to that blocked area of the artery and catch the clot and remove that with the hopes to restore the blood flow to the area and again prevent a smaller area of damaged brain. We have a little bigger of a window that we're able to perform this procedure up to 24 hours from the last time the patient was known well, or basically once they started having the onset of symptoms. Many people kind of will say, oh, I have a little bit of weakness that happened suddenly, and kind of just say, I'll see if it gets better. And it's a majority, up to 70% of people that don't come to the hospital until after 6 hours or more after their symptoms start. And at that point, again, time is brain, so more brain tissue is being damaged within that time. And our ability to provide these treatments decreases the longer it takes to come into the hospital. Yeah.
Okay, so a person's had a stroke, they've come to the hospital. What happens then after the stroke? So generally, someone who's had a stroke gets admitted to the hospital, and they receive this acute stroke treatment if they meet the criteria that Nicole was just talking about. So they, if they came in quickly within the 4.5 hours and they were eligible for it, they could receive the TPA medication, the clot busting medicine, or if they saw the large vessel occlusion, they could go for the mechanical thrombectomy. Immediately when someone shows up at the hospital, the first thing we do is we get a CAT scan. We're using that initial CAT scan to take a look and determine if there's any blood in the brain, if it's a hemorrhagic stroke. That would prevent us from being able to give that clot busting medicine. But if the hemorrhage is not there, then we can offer that medicine if it's within that time frame. The other type of imaging that we do is an MRI, and the MRI actually gives us much more detail about the brain tissue. Sometimes we don't do that right away because it does take longer to do an MRI, but during the hospitalization, that would be something we use. And it helps us diagnose the stroke, where exactly it is, and it helps the doctors to determine what might have been the cause. And then a good part of the time that somebody's in the hospital, they're doing a workup. They're doing a very comprehensive stroke workup to determine the cause of the stroke. Because most importantly, we know a stroke's happened, but we want to know the cause because we want to help prevent something from happening again and someone having another stroke. So we'll look at the risk factors the person might have. We might, start new medications to help manage those risk factors. And then the patient would be assessed by rehab therapy. And that would be physical therapy, occupational therapy, and speech therapy. And that happens very quickly, usually 24 hours, to really get these therapies started and to help improve recovery time. After hospitalization, it might be necessary to continue with these therapies, and the inpatient therapist will determine what level of rehabilitation a person needs. So, they will assess the person, and based on their recommendations, someone might go to for acute rehab, somewhere like Gaylord Hospital or Milford Inpatient Rehab, or they might not need quite that intensive level of therapy, and they might go to a short-term rehab for a short period of time, just a couple weeks or less. And or it might be determined that they can safely go home and either have therapy come to the house or go to a outpatient therapy location where they would just go have their treatment and come back home. And then always we would make sure that there was follow-up with the stroke neurology team and primary care to help continue treating the stroke, preventing future strokes, and managing risk factors. So some take-home points. Many strokes are preventable. Talk to your healthcare provider about your personal risk factors. High blood pressure can be checked, easily checked. It can be lowered and controlled with medications and healthy habits. And it's really important to talk to the healthcare provider about managing this blood pressure. If somebody smokes, it's really important to quit the smoking, and that can help decrease the risk of stroke. Really, if there's nothing else you take from this today, try to recognize these stroke warning signs for both yourselves and your family, friends, or a stranger. You may, like Nicole said earlier on, save a life. So recognizing balance, eyes, face, arms, speech, time, acting quickly, calling 911. And again, time is brain. Calling 911 for yourself or for someone experiencing a stroke, really can help save a life and decrease their disability from stroke. There are resources available. The strokeassociation.org is a great one. I'm not familiar with that phone number, but we use this website quite often. There's also strokeconnection.org, and there's a support network also through the Stroke Association. And thank you. So, as we said, we're happy to answer any questions. We can stop sharing this so that we can see you again. But, please to keep your questions general. We're really not able to.
We're having trouble hearing you.
Okay, I was just saying, we're going to stop sharing the screen so that you can see us, and we're happy to answer any questions. But again, it's really important that we just keep the questions general. We can't speak about individual situations.
And I'll just take a look at what's in the chat as well. Maybe I'll start with the chat first, and then we can open to if anyone wanted to speak. How can one best avoid a second stroke? Yeah, so good question. If someone's already had a stroke, the main thing is to one, take the medications that the providers are recommending to prevent stroke. And then once it's determined what the possible cause of the stroke is, which is usually related to these modifiable risk factors that Dawn had brought up to you. So the blood pressure, diabetes, smoking, obesity, sleep apnea, getting those under better control can significantly decrease your risk of stroke happening again. And then the second question was, what are the symptoms of TIA? And they're actually exactly the same as the symptoms that we went over for stroke. A TIA is something called a transient ischemic attack, which is decrease of blood flow to the brain for a short period of time. However, for example, if there's a clot that's in the blood vessel that dissolves on its own without us doing anything, you will quickly go back to normal. So possibly you had symptoms for about 15 minutes and then they completely resolved. And then the MRI scan shows that there was no stroke, but your symptoms were consistent with that. Then that's when we call something a TIA. And to prevent a stroke from happening, an actual stroke from happening, is exactly what I just discussed before. as far as preventing stroke.
Add to that, that if you had symptoms of a TIA or stroke and they did resolve in that, short period of time, such as Nicole said, it's still important to come to the hospital because something happened that stopped that blood flow. And we want to look into that. The next time it happens, it could be a stroke. And someone who has had a TIA is at more risk for having a stroke in the very near future. So important to still get checked out.
Anyone else have any questions they wanted to bring up? Yes, Victor.
Yeah. Apparently, the cable companies, the telephone service, are warning in small print that 911 will not necessarily take you to a local center, and that is a reason that you could have a delay in emergency treatment. I wonder if somebody knows anything about 911 in our area.
Well, are they saying they like maybe not take you to Yale, but they might take you to a smaller hospital?
Well, or you would be talking to some regional emergency number, not to the local one.
I have not heard that. That's interesting. I would have to look more into that, but
In the advertisements, there in small print, usually a warning about that may not go.
I'm not sure what that background noise is, but I can tell you, one of our coworkers works in Renisha. She's the one who set this up. She does work in the outreach, and she's our outreach coordinator, and she works very closely with all of the emergency services here within the state, but mostly in the New Haven area.
Yeah.
And has been doing a lot of education with all the local fire departments, as well as AMR, the bigger ones. And they've all been, training in recognizing stroke signs and symptoms. I haven't heard that about the 911 operators though, but I will bring that question back.
Thank you.
So I'll ask a question. First of all, thank you very much. That was a wonderful presentation with lots and lots of information. And it's good we recorded it because then we can review it if we need to. I just wanted to add that calling an ambulance gets you in very quickly to the emergency room because they call ahead and then the emergency room is expecting you and you don't have to sort of go through, the front desk or anything. They just take you right in. So I really recommend that. I have a question. A lot of, and quite a number of Home Haven people live alone. And so any ideas for people who live alone are welcome. And some people have devices where they can press a buzzer and call 911, but I think it's something that we should all be aware of and help each other with. Do you have any thoughts about that?
Yeah, that's a tough one. I agree. I love the idea of the devices like the Lifeline. I know sometimes people are hesitant to use them, but they can be very effective. And, even if you can't speak or get to a phone, it can get you help. Somebody who can't speak and there's nobody there to do that for them on the phone, if they call 911 and there's an open line, it's going to be investigated. So still help will be brought forward. Do you have any suggestions?
Sure. And I also kind of would advise if you have either a family member or a friend who you're close with, just kind of if you live alone and having somebody to check in with every day, I think is a great thing. Just check in, make sure you're hearing from them. And if you're not, or you can't get in touch with them, maybe alerting 911 or something if you're concerned that that something actually is happening. I think that that's important to do. So you have, especially, you know, living alone, that can be scary. And if you can't, for example, get to the button or you don't have one, and if you do happen to wear an iPhone or an Apple Watch, that's another way to be able to call if you don't have your phone with you, or a button. And I will say, Susan, thank you for saying the 911, to call 911. It is not advised for a family member or for yourself to drive to the hospital on your own. It delays care. And also, if something gets worse and you're in the car, there's nothing that can be done. So definitely calling 911 and coming in through an ambulance. It alerts our team prior to your arrival, and we meet you right in the hospital, in the emergency room, to start evaluating you and bringing you for imaging.
Yeah, and we have a very robust program here at Yale that we're.
It's hard to hear you, Dawn.
Sorry, I was just gonna say, also along the lines of calling 911. Is that better?
Yes.
Okay. You know, we have very strict rules here at Yale, and I know all the hospitals in the area do as well. You know, where when somebody rolls in, our goal is
It's hard again. We can't hear. I'm
It's-
sorry.
That's okay.
Yeah.
Sorry, I feel like I'm on your face,
Maybe-
is like
maybe-
right there now. But you know, our goal is to have the evaluation within 5 minutes of you arriving here, and then having that person in the CAT scanner within 10 minutes. So it's all very fast. If you've ever come to the emergency room under these circumstances with a friend or for yourself, it's really, I think, scary and overwhelming, because suddenly there are all these people assessing, but it's so important. And then, you know, after that initial time period, we can pull back and spend time talking and, you know, finding out more information. But it's very quick. Get the vital signs, get to the CAT scan, very, very fast.
Yeah, Lori, did you have a
Lori.
question?
Yeah, I just want to underline what you said about not driving if you think you've had a TIA, or if you're with someone and you think they've had one or they think they've had one. I think that's really important for Home Haven, because our members drive each other a lot. They drive each other through a volunteer driving program that we have. And our members also drive each other quite frequently when they're carpooling together to a Home Haven event. So members are often with each other in cars, and they're often with each other, you know, at each other's homes and at events and programs. And I just think it's so important that you mention to us that even if you think you can get that person to the hospital quickly, absolutely not. We do not ever drive another member to the hospital in an emergency situation. We just, you know, you can't do that. And you've really pointed that out to us. So it's just not safe.
Right, yeah, thank you.
Thank
It's
you.
definitely very important. Anybody else?
Face.
Cindy Crooker
yep,
has had
Cindy.
her hand up.
Yeah, can you talk more about sleep apnea as a cause of stroke? Is it the lack of oxygen? How does that work?
Oh, yes. So sleep apnea is something that people don't think about as much. And there's kind of two reasons. So when you're sleeping and your sleep apnea specifically is stopping breathing, which increases kind of the carbon dioxide going to your, or in your system, really. The issues with that is, one, it can cause intermittent, very high spikes in blood pressure when you're not breathing, and over time that can cause the blood vessels in the brain to become weak and then cause stroke. Also, sleep apnea itself, because it puts a lot of stress on the body and the heart, can increase your risk of that abnormal heart rhythm, atrial fibrillation. And that's another big risk factor for stroke if you have that abnormal heart rhythm. So that's how it's kind of directly / indirectly related to stroke. So it's a question that we ask, and if someone does have sleep apnea, it's extremely important to be evaluated. And if the recommendation is for like a CPAP machine or a mask, that you're wearing that every night to decrease your risk of stroke from sleep apnea.
Thank you.
Anyone else?
Yeah.
Nancy has a question.
Yeah, I had a question about what's the treatment for hemorrhagic stroke?
Well, that's a great question. So the initial treatment for hemorrhagic stroke is kind of supportive. You know, when we see blood in the brain like that, the first thing the provider looks at is that person on a blood thinner? You know, are they on Coumadin, Eliquis, Xarelto, one of those medications? And if so, we're going to look at giving medicine right there in the emergency room quickly to help reverse that anticoagulation. So to stop that blood thinning property and slow down the bleeding. But then the other thing, we get the neurosurgeons involved very fast. And the reason is they're looking at those blood vessels. And one of the CAT scans that we do there in the emergency room is it's called a CT angio. It looks at blood vessels. We give some contrast through the IV. It's very quick, and we can see the blood vessels in the neck and the brain. And we're looking to see if we can see any reason right away for that. Like, is there an aneurysm that ruptured? And the neurosurgeon will make other recommendations. There are some procedures that they can do, drains, you know, some surgical procedures they can try. But the really most important things in that initial period in the emergency room is to reverse any anticoagulation and to look at the blood pressure. And if the blood pressure is elevated, we're going to bring that blood pressure down really fast and take the pressure off those vessels. Because the high blood pressure in that instance can cause more bleeding.
Okay, thank you.
Yep. Cindy, did you have
Anthony, want to ask a question? You have to unmute Anthony. No, you're still muted.
Anthony, we can't hear you. Can you unmute? Your microphone's muted.
You go. Can you hear me now?
Yes.
Oh, I'm sorry. Yes. No, it was a very enjoyable and practical discussion. I learned a few things I didn't know, of course. And I really don't have any questions because I'm generally familiar with the topic, but I thought it was very well presented, and thank you.
Of course, you're welcome. Thank you.
Thank you for having us.
And Cindy has another question.
You'd mentioned that a TIA might prefigure a stroke. Is it true that if you've had any kind of stroke, you're more likely to have another one?
Yes, if somebody has had a stroke, they are at risk for future strokes, which again goes back to making sure we're looking at those risk factors and treating the risk factors and you know, working on preventing future strokes. So anyone who's had a stroke should be connected with a stroke team of doctors in the outpatient setting and continue to be monitored.
And Harriet,
Do seizure disorders have any relationship to strokes?
What kind of disorders?
Seizure
Seizure.
disorders.
Seizure.
No, there's not a relationship with stroke. For example, if you have a seizure disorder, it doesn't increase your risk of stroke. Sometimes stroke itself can cause seizure. But generally speaking, if someone has issues with seizure, it doesn't increase their risk.
Thank you.
So I was impressed with the thought that even with the TIA that goes away with you might have symptoms and they go away, you still should go to the hospital and get evaluated. I
Yes,
thought
definitely. Definitely, because as Dawn was describing, especially when someone has a TIA, they are in the coming weeks at very high risk of having an actual stroke. So it's actually a very big warning sign. And making sure that you're on the right medications and trying to work on, for example, if you have really high blood pressure, when you're in the hospital being evaluated for stroke, getting those things under control, and being on medications will decrease your risk, especially in that really, high risk period. So when we do a workup in the hospital, looking at your heart, monitoring your heart, things like that, that can help us to decrease your risk of having an actual stroke. So that is why it's important to be evaluated for sure.
anyone else have something, some thoughts or some questions, some clarification? So I think that we are at the end then.
All right.
Is that correct?
I think so.
okay. Okay, so thank you so much, Nicole and Dawn. This was terrific.
Thank you.
And
Yes, thank you so much for having us. It was great to talk to you all today. And glad that we were able to get some awareness out. And
not hearing you, not hearing you.
Sorry about that. I said, great. Thank you for having us and great to get some awareness out today. We hope that we can help you or someone else if any of this comes up. And I hope we don't see you at Yale New Haven Hospital, but if we do, we will do our best to take care of you.
Thank you.
Thank you.
So much.
Thank you both. That was really wonderful.